Hi, it's Chris again, the RCP-SG Trainees Committee representative. This video will focus on other methods of recording your training, focusing on your logbook, reflective practice, and personal library. So let's start by looking at the IMT acute take calculator and log of clinics and procedures. Maybe take a moment to familiarize yourself and we can talk you through it. It is split into 3 sections. The Acute Medical Take Experience Calculator allows you to document how many patients you review whilst on call. This is defined as input being sufficient to have your involvement documented in the patient's notes. By the end of IMT, you should have seen 500 patients, with a minimum of 100 each year. The calculator means that remembering individual names and cases is not necessary, but keep track of the number of patients that you see. The log for outpatient clinic attendance is in the second tab, following a similar layout. You are required to attend at least 80 clinics over the 3 years. At the end of each year, transfer your clinic attendance into the Summary of Clinical Activity and Teaching form on your e-portfolio. Use mini-CACs and CBDs to get documented feedback from your attendance when possible. Finally, the last tab allows you to document your procedures. Familiarize yourself with what is required early so you can take every opportunity to get them signed off. It is good to identify certain clinics, for example pleural or cardiac clinics, and rotate through these with your colleagues. Please note that some of these procedures require you to be competent at a clinical skills level only, so look these up in advance on the IMT ARCP Decision Aid. Your educational supervisor will review your spreadsheets, so keep them updated with your progress and let them know early on if you are struggling with clinic attendance. At the end of each year, upload your updated spreadsheet so that it can be reviewed at ARCP. Reflective practice is a really useful way of recording different aspects of your training. You can use it to support your clinic and take experience by documenting important or interesting cases, including any challenges, such as communication challenges. It can be used to support your curriculum sign-off and provide evidence of attendance. You can also document teaching and educational experiences and reflection on any untoward incident. As in any record, it is vital that you do not include any patient identifiable information. Finally, your personal library. This is where everything required for ARCP at the end of each year should be uploaded. This includes Clinic and Take Calculator and Clinical Procedures Log, Form R, MRCP certificates, ALS and Teaching Attendance certificates, any relevant e-learning certificates, patient surveys, QIP or audit forms and summaries, any feedback from teaching that you have delivered. Remember that the ARCP panel will be using this to sign you off each year, so try and keep your folders logical and easy to find. Thank you for watching this video. For further information, visit the JRCP TB website, where you can find the full curriculum, the rough guide to IMT Stage 1 training, a guide to using the e-portfolio, and a section of frequently asked questions. If you have any other queries, you can contact us using curriculum@jrcptb.org.uk or via the JRCP TB Twitter account.